welcome back to Baby Steps in This Together. Today I'm speaking with Dr. Moira Kwok, a naturopathic doctor with a clinical focus on women's health, fertility, pregnancy, and hormones in Toronto, Ontario. How are you doing today?
Good, how are you?
I'm great, thanks. So let's start right from the beginning. Do you want to tell us a bit about your journey so far?
Yeah, so I guess the very beginning, because I guess that's where I should start. My husband and I got married in 2013, and we figured, we'll try and see how things go. And just assumed, like everybody else, that we would just get pregnant, no problem. It'll be a few months. Maybe we'll wait like 6 months. But we just didn't think that it would take very long. I mean, I figured I'm a naturopath. I should have this whole thing down. I understand how this all works. And then like about almost a year later, we're like, this still isn't happening. And it's just like we're timing it and everything's going exactly how we thought it, nothing was really working at all. And it was getting really frustrating, of course, after a year,
Mm-hmm.
and started talking to a couple of colleagues of mine. And I should have known better. I mean, I see patients with fertility, and I don't know, this is why you shouldn't treat yourself or your patients.
Yeah,
And
for
I just
sure.
kept thinking, yeah, it'll be fine. And spoke to a couple of my colleagues, and they're like, maybe you should look into fertility. And I was like, yeah, maybe I should get a bunch of testing done. I started the referral process in probably, we got married at the end of 2013, so sometime in 2014, and joined one of the clinics downtown. I think by the time we got things rolling, it was probably the end of 2014 into 2015, and joined a clinic there. Had a pretty good experience. It was a great clinic. I've heard great things about them. Had great things to hear about the doctor there. And I don't have anything bad to say other than it didn't jive with me very well.
Can I ask which clinic it was?
It was, yeah, it was Trio. I send patients there. I really like them. For me, it was a great place to be, but when I went in for my appointment, I went in obviously armed with a lot of information. I walked in wanting more support. I walked in saying, these are the things, and then we did a whole bunch of testing. We did some cycle monitoring, um, went through all the tests that we could think of, and at the end of it, walked into my appointment with all that information, knowing how to interpret that. And the doctor was just like, okay, well, what do you want to do? And I was like, well, no, I kind of know what my options are. I just need a little bit of guidance.
Mm-hmm.
Um, and they work so well with naturopaths. And I guess maybe because they were so used to working with healthcare people, he was just like, no, let me know what you want. Like no pressure on anything. And I just felt like I needed a little bit more of, this is sort of what I do. This is what I think is best for you.
Mm-hmm. That's
So
fair. That
that's
makes
my only
sense.
thing. Yeah, so that was the only reason. There's nothing wrong with that clinic. I love it. It's lovely. Patients love it.
I'm
And
with
then
Trio as well.
are you?
Yeah.
Yeah, they're a great clinic.
Yeah.
Um, and then I ended up speaking to another colleague of mine who said, hey, have you heard of this other, I don't know, I guess since I'm name dropping clinics, Mount Sinai? And I said, oh, yeah, yeah, yeah. I didn't think about them at all. I don't know why. Like, I just heard such great things about Trio. So she's like, oh, you should check them out. And I got a referral to them. And I guess life happens in a funny way, because had I not gone to them, I think things would have potentially gone really bad for me really quickly.
Oh, wow.
Because I eventually signed in with Mount Sinai. I did an IUI. All of our test results came back normal. Everything was normal. So they said, while we wait for IVF, let's do an IUI. I, being a naturopath, wasn't even sure I wanted to do I go through with IVF. So I said, okay, well, let's
Mm-hmm.
give it a try with an IUI and see what happens. Very hesitant with all the medications and everything else,
Yeah.
as most patients are. So I did the IUI, which was in 2017. I feel like I'm missing a year somewhere, but 2017 was my big year. I did my first IUI the long weekend in August, and I know this is going to get to somewhere. That actually was the same weekend that's my brother's birthday. So a couple days after I did the IUI, we went out to his birthday dinner, and then that night and into the next morning, I was in not a good place. Ended up the next morning where I was spiking a fever and I was nauseous and in a lot of pain. So I said to my husband, I was like, I gotta go to the hospital. This isn't, I assumed it was food poisoning the night before, but it
Oh, okay.
wasn't.
Yeah.
So that's why my brother's thing kind of comes into play. Went to the hospital at Mount Sinai into the ER, and they're like, what happened? Did all the testing. They assumed it was a terrible case of food poisoning. So after a couple days, sent home. And I thought it was the same thing, but I couldn't get rid of the fever, which should have been our first sign that there was something
Mm-hmm.
wrong. I think like I went home for maybe a day and ended up in the hospital again in excruciating pain. I thought it was my appendix at this point because it was that bad.
Yeah.
They
Ouch.
at the hospital they figured the same thing, but they went through all the testing again, like everything was done. They had an OR prepped for me to go in just
Just
because
in
they
case.
figured, because I had all the signs. But they said, well, let's give you a CT scan just to, like, thank goodness we're in Canada.
Mm-hmm.
Let's do a CT scan just to make sure. And they went and I did a scan and they found out that it wasn't my appendix. My appendix was totally fine, but they couldn't figure out what it was. So the OR was canceled and I was in the hospital for about a week on IV fluids, a whole bunch of really fun pain meds. Never in my life have I ever been on so many medications.
Mm-hmm.
But at the end of that week, nobody could figure out what was going on.
That must have been
So
so scary.
it was, but I was really lucky for knowing it was my first time in the hospital, like as an adult, or
Mm-hmm.
even as ever, other than when I was born. And it was an interesting experience because yeah, it was scary because nobody could figure out what was wrong. I kept getting bumped from department to department from like specialists, and nobody could figure it out. And at the end of that week, we all just kind of sat down and said, there's nothing going on. We can't figure it out. Just go home because I'm just, bored at the hospital.
Yeah.
I was
Just
going
hoping it'll pass on its own at that point.
right and
Yeah.
just going stir crazy. And I was very, very grateful to have been a healthcare practitioner because then I could speak the language.
Right.
And that really helps me kind of get through the system a little bit better. So I went home for about a week, and then literally a week later, Sunday night, um, I ended up paging, which is funny. They still use pagers. Paged one of the fellows who was such a great um, advocate for me, I guess, and such a great help. She's actually now one of the fertility doctors at another clinic. Um, and I knew something was wrong because this is getting a little way personal. Anything that I was eating, which was barely anything, and anything I was drinking wasn't going through, it was just coming out again.
Mm-hmm.
So I knew there was something seriously wrong. In the back of my head, I knew it was an intestinal blockage. So paged her. She's like, yeah, you better come in. Went back in, and that's when they did another all around testing again. Did another CT scan to find out that I had a full intestinal blockage. And the reason was because there was an abscess that developed, and it had grown so big at that point that it was like wrapped around a part of my colon, and
Oh,
nothing
wow.
could get through. So at that point, sounds weird, they installed a drain in my abdomen, which I got to wear strapped to the side of my leg for about 6 weeks.
Oh,
And
boy.
that was when we discovered that the IUI, because this whole time we just figured I had a horrible case of food poisoning. Like we
Mm-hmm.
called public health. They went and inspected this poor restaurant that I went to. It
Oh,
was awful. Like it was
yeah.
not good. Nothing came of it. Like they did all the testing, nothing came of it. And that's when they figured out the IUI had probably been the one thing to cause what they call PID, which is pelvic inflammatory disease. And that just went a little ballistic. So after that, this is a really very convoluted story. The next year, I was really scared. I didn't want to do another IUI. Mount
Yeah, oh, I
Sinai
bet. Like
didn't
scar
want
you
to
for
do
life
another.
from.
Yeah, pretty much. My amazing doctors at Mount Sinai didn't want to do another IUI. So we talked about it and said, let's do all the testing again. And that's when they found out that both of my fallopian tubes were now blocked.
So they weren't blocked before all of this, and then they
No.
were.
Hmm.
Interesting.
Yeah. So then I ended up going to see a surgeon who had previously told me that he didn't want to do any type of surgery on me because they had, in my testing for IVF, confirmed that I had an endometrioma, which I had known that I probably had endometriosis since I was little, but nobody could firmly diagnose it. And he had originally told me when I first went in, like years ago, that he wouldn't do surgery because it would negatively impact my fertility,
Okay.
potentially,
Yeah.
if he had to cut any part of my ovaries. So we had at the time decided not to do the surgery. But then I had to go in again and see him. And because my fallopian tubes were blocked, he was like, all right, this is what we're going to have to do. We're going to have to go in and just basically figure out what's going on. Like worst case scenarios, we'll just have to tie off your tubes. Um, and so we went in because there was no other, like they couldn't figure out what was going on. I had the surgery, but right before I had the surgery, I actually did a retrieval for IVF because I didn't want to risk everything tanking.
Mm-hmm.
And then basically did my IVF retrieval. The next month following, I did my surgery. And that's when they found out it was just a bit of a disaster in there. There was a lot of scar tissue. I very, very distinctly remember coming out of surgery and my surgeon coming to speak to me. He's like, yep, so we had to take out your fallopian tubes. They were basically the size of breakfast sausages,
Oh, wow.
which is significantly bigger than they should have been.
Mm-hmm.
And it was very messy in there, and they had to kind of clean everything up. And then I ended up doing a transfer a few months later, and very luckily, kind of super lucky, got pregnant on my first round.
That's amazing.
Yeah, so that's my very long, convoluted story. of, I hope nobody else has to go through that. Apparently, it's not very common at all, and I should have apparently got a lotto ticket or something because it doesn't happen
Yeah.
to a lot of people.
Wow. It's
Hmm.
incredible. You definitely went through the ringer. I'm so happy that your transfer worked out first try. That's
Oh,
incredible.
I know. I was like, this is, I don't even know what's going to happen. I was so nervous going into it, but
Yeah.
and I know they were very nervous going into it as well. Like everyone was so scared of my file because it was a very large file that shouldn't have been that large.
Yeah.
Yeah. Hmm.
So you mentioned not being sure about your feelings about IVF going into it in the beginning. So how did you feel when that kind of almost became your only option?
I think that actually helped because it was my only option.
Okay.
Because if I didn't have that as an option, my other option was I couldn't have my child. And
Mm-hmm.
then my husband and I were actually like, okay, do we do this or do we look into other options? And we just didn't know what to do. That was a bit of a big conversation for us to have.
Yeah.
And then we decided, okay, well, we'll do it once. If it doesn't work, it doesn't work. Then it's just not meant to be and we'll figure something else out. But luckily for us, it did work.
Awesome. How many embryos
Mhm.
did you end up with?
I was actually really surprised. So I was 38 when they did the IVF retrieval, and I wasn't expecting amazing numbers, knowing all of the history that had happened, like
Mm-hmm.
in the year before, and just all the craziness that had happened. Um, they were able to retrieve 9 follicles, and I got the call that all 9 of them had actually fertilized,
Oh,
but
that's
only
awesome.
4 of them made it to the end. So we had
Yeah, those are
4.
some great numbers
Very good
considering.
considering
Yeah.
I was in my late 30s. Yeah.
Hmm.
And with all the nuttiness that happened.
Right.
But yeah, that's what my numbers were. I was expecting the worst. When they told me 9, I was so not upset. I was happy there were 9, but I was like, oh, I was really hoping for more
Hmm.
because they could visualize a lot more.
Oh, okay.
But because we found out later, but because of all the scarring, my ovaries were kind of stuck to the back of my pelvis, so they
Mm.
couldn't access all of them,
Oh, okay.
which is
Okay.
why the numbers that were retrieved were probably so low.
Yeah. It's so hard
Hmm.
not to get your hopes up throughout the whole
I
process. Like,
know.
it's so important to have realistic expectations. That's like the only thing that saved me during my
Yeah,
process is be realistic, be realistic.
yeah. But no
Um,
matter how realistic your like brain is, like that heart, that hope,
yeah. It just
it's
sneaks up
so
on you.
hard. Oh, it does, right? On everybody. So
Hmm.
yeah. Hmm.
The your fallopian tubes getting blocked, was that anything to do with the PID, or was that just a completely separate thing that came up?
It was probably a consequence to the PID.
Okay.
Yeah.
Okay, I see.
Hmm.
So like in pelvic inflammatory disease, what is it that's happening in your body that's causing the pain?
For me, so I don't think pelvic inflammatory disease always causes that much pain. It just so happens. So pelvic inflammatory, it's sort of PID is like an umbrella term for a whole bunch of things that can go wrong. And so for me, unfortunately, what went wrong was the abscess. So basically,
Right.
something got in there that resulted in my body going, oh, this isn't supposed to be here. Let's like take care of it. And they took care of it by like trying to send a whole bunch of things there to fix it. And what happened was an abscess developed, but it kept getting bigger and bigger. And so as it got bigger and bigger, the part that started to become really painful was when it started to compress on my colon and like
Okay.
um, not cut it off. That doesn't sound like that's not the right
Like
term
constrict
for
it
it.
or
Yeah,
yeah.
yeah, by wrapping around, yeah, constricting it. And if you talk to anybody who's ever had any sort of obstruction, whether it's from colitis, like a lot of colitis patients will have obstructions potentially,
Hmm.
um, everyone will say how painful it is. So that's where that pain came from. Not, it's not necessarily always the
Okay.
issue.
That makes
Yeah,
sense. Gotcha.
yeah, yeah.
As someone who works in the medical field and specifically around women's health and fertility, do you think your knowledge and experience in the field affected your outlook on the whole situation or your experience, whether positively or negatively or both?
I think that it definitely had a big impact. I think that a lot of us are very stubborn. I'm going to speak for a lot of us, but I have to just speak for myself. But I'm pretty sure it applies to a lot of us in the medical field. Um, I was just like, yeah, this isn't going to happen. I got this. Like, it's fine. Like, it's just, I'm just being too stressed out. I'm this, I'm that. And you can always kind of rationalize everything. And so I
Mm-hmm.
think it definitely worked against me at the beginning in that I should have started looking into it a lot sooner. But when everything went sideways, it really, really helped me because I could then figure out as well on my own and with the support of all the people that I work with and my own people that I have like a great team with. I was able to figure out what was going on a little bit quicker and not freak out about it. So everyone was
That's
saying
good.
how calm and positive I was because there was just no reason, there was no time to freak out. I guess the freak out really happened afterwards, like well after, when I realized, when I turn around and see like what had happened and know all of the potential consequences that could have happened.
Mm-hmm.
But in the moment, it was just like, all right, well, what's the next test we have to do? What's the next step? How do we figure this out? So that really worked to my advantage. And I realized that big time when I was lying in my hospital bed and there was the woman next to me, I was so drugged up, I can't even remember exactly what she had, but I just remember that she said to me at some point, she's like, how do you keep your doctors with you for more than like 2 seconds? Like they usually come in, well, not 2 seconds, like maybe a couple of minutes. She's like, how do they come in and spend like 15-20 minutes with you? Like, I don't understand. And I was like, what are you talking about? And then I started kind of paying attention to the type of questions that she would ask her doctor versus the types of questions that I was asking my doctors. And I realized that a lot of people who aren't familiar with the medical system, when you're in the hospital, the, there's very common questions that people will ask. It's what is it, right? They sort of, to the extent of what can I do about it, like what's the treatment, and then when can I go home. Like,
Yeah.
those are the only questions that most of the people, because I stayed in the hospital for quite a while, so I had like a rotating door of neighbors. And that was the questions that I noticed that people were asking a lot. Whereas for me, it was like, all right, so what are the test results? What's the next step? How are we going to do that? Like, when are we going to do that? And what are we like ruling out? What are we ruling in? So it was like I had a lot more questions. But
That
it's
makes
very,
sense.
yeah, it was very specific, where they couldn't just be like, this is what you have, this is what you're going to do. We don't know when you can leave. Like, that's basically their answer. So that really, really helped me, I think, at the end of the day, figure out what was going on.
In your field now, do you ever use your own personal experiences to help out other women, or do you kind of keep your own like separate from your clients or
So when I
patients?
was going through it as in like all the years that we kind of struggled to get pregnant, it was this weird thing because I still since I was a student, I loved working with fertility patients. It was one of my passions from way before I even had any inkling that that was going to be something that I would have to deal with personally. So it was this weird, not that I was lying, but it was just this weird sense of like feeling really lonely, knowing that I wasn't the only one out there because I would speak to patients about it all the time. But I couldn't then just dump my issues onto patients, obviously. So I never really spoke about it when I was going through it. But then I ended up in the hospital and people started asking, like, is she okay? And nobody knew, like all of our front desk, nobody knew what to say because at the time, nobody knew what was going on. And so by the time I got back, I have such lovely patients that they all came in and saw me, like not all at
Aw.
once, but eventually they all came in and they would ask how I was doing. And if they prodded a little bit more, I would tell them very briefly what happened. And from that point on, I just started telling my story more and more. It's not something that I would, as a patient who steps into my office wanting support with fertility, it's not like, oh, here's my story. But depending on the situation, I will bring it up so that they don't feel as alone, so that they
Yeah.
understand that I 100% understand where they're coming from when they talk about all the feelings that are circling around and all of the crazy tests that you have to do and the schedule of tests and like I understand all of that, the ups, the crazy ups where every month you're hoping, and the crazy downs where it's either a negative test or you get your period, and all of that. I 100% understand it and went through all of it. And I find that patients are pretty appreciative of that I understand. And it's not
Yeah.
just me, not that I was just talking about it before, but I didn't understand as much as I do now. So I will bring it up and I'm open about it now. I was pretty open about it in my personal life at the time, but it's just sort of a bit of an open book where people will pretty easily find out my story.
That's good. Yeah, I think
Mm-hmm.
from a patient perspective, it is really helpful to know that the person that's taking care of you and trying to help you get pregnant also understands the struggle to that degree. Like before my IVF cycle, we had to do a mandatory counseling session.
Yeah.
And the counselor that I was speaking to, she had also struggled with infertility. So I found
Yeah.
it really, really good to like go back and forth and talk about those feelings and really know that the person understands what you're going through. Because a lot of people that aren't going through it they try to understand, and they try and say, oh, I totally understand what you're going through, but a lot of them just don't.
Yeah, it's really hard because it's one of those things where you unfortunately just don't get it unless you've gone through it. And I don't want other people necessarily to go through it just to understand. But there's so many nuances to it and so many things that not you in particular, but someone who hasn't gone through it, they can say certain things that just set you off. And it's this,
For sure.
right? Like all those people are like, oh, you've been married for however long. When are you guys going to get, you shouldn't wait too long and just keep trying. Like all those things that people say to you that you just kind of smile, brush it off, and inside you just want to cry.
Yep. Smile and nod.
Yeah, exactly. Right. And it's just people can learn it, but I think people who've gone through it it's this like group, it's this club that you've joined that you didn't want to join. And it's a nice support system.
I guess my last question I'll ask is, do you have any advice to share or things you wish you would have known if anyone else is in a similar situation? Just any advice, even from the perspective of what you do for work, what advice would you give?
Number one, don't do what I did. Don't wait. I actually tell all of my patients this. I'm very particular about it now, where if anybody walks into my office and they say anything along the lines of, I've been trying, but we're going to wait like another year before we start looking into it. If you're, 22, 25 and trying, then I'm much more willing to not push it. But if you're anywhere near 30 and somebody says that to me, I will say, I'm not saying that you need fertility treatments. I'm not saying that you need IVF or IUI. I'm just saying get the ball rolling now on getting your referral, because that takes time, right? Making an appointment with your family doctor can take time. Then getting that referral can take time. And then getting that appointment can take time. And getting all those tests lined up, cycle monitoring, blood tests, ultrasounds, all of that fully lined up can take time. And it can take a lot more time than you think it will. So by the
way more.
time you're way more than you think it will. So by the time you even wrap your head around the fact that maybe you'll have to go to a clinic, it's already been however long. So I always tell patients, like, just make that call, get the referral now. If you don't need it in the future, great, you can cancel it. If you go through half of it, like you have your appointments, you do, all the testing, and then you don't need it, that's great. But at least get it done now, because the sooner you do it, the more you will be much better equipped with all of your test results to figure out what's going on. And
I completely agree.
You can make a much more educated decision on what to do.
Yeah, that's
so
one
that's
of my
like number one.
For sure. That's
For
one of my
sure.
things as well, is I wish I
Yeah.
had gone sooner. But I was like, when I got married, I was 27 and, still young according to everyone.
100%. Yeah.
So didn't think, I mean, I still went and got help 6 months in because I'm like crazy and I need to know everything.
Yeah. That's
But
okay.
yes, even then, I'm like, I wish I had even done investigations about my fertility like before like I was even thinking about having kids, because it's just good to know about your body and make informed decisions.
100%, which is funny you bring that up, because I actually will talk to, because I deal with a lot of women's health.
Yeah.
So it doesn't just mean I deal with only fertility. So whenever a patient comes in and I'm not going to ask every patient, do you want to have a baby? Like, that's a little aggressive. So it's just if somebody mentions like, oh yeah, we're thinking of getting pregnant in however many years, or I would like to have kids, but I don't have a partner that I want to have kids with yet. I will still have that conversation with them to say, you know what? It's a good idea to talk to your family doctor if that's the route you want to go through, to say, I want to have kids in the future. Can we just do a bunch of testing? I just want to know my baseline. And I think that that's a really, really good idea. Because again, like if you haven't met your person and you're not ready to have a baby yet, but you're armed with all the information that maybe your AMH is super low, maybe your ovarian reserve is super low, maybe maybe there's all these other obstacles that are potentially in your way, then maybe at that point you'll be like, okay, I need to work a little bit more on this. I need to see a naturopath. I need to see a nutritionist. I need to overhaul my diet. I need to do all these things in order to optimize that so that when I do meet my person, then I'm
You're
much
ready.
more ready to go, right?
Yeah.
Or even, and this sounds kind of awful, but even if you decide, okay, well, I don't know what's going on, maybe I'll freeze my eggs, or maybe I'll use a donor, or maybe it even opens your eyes a little bit more to the possibility of people as opposed to just cutting it off because you don't have time because you're focused on your career, focused on everything else. It doesn't mean you can't have both, but it just gives you more information to make informed decisions.
Exactly. I think just
Yeah.
like a lot of the problem with all this and the reason why a lot of people don't get tested is because a lot of people just don't know all of the things that could be wrong or like
Yeah.
how low the chances of getting pregnant are in general,
Yeah.
even if you're completely healthy and have no issues.
Yeah.
And, everyone just looks at life as in like, okay, gonna meet someone, gonna get married, gonna have kids. Easy
Yeah.
peasy, step one, step two, step
Easy
three.
peasy. Exactly.
But so many times it doesn't happen like that. And I think just people aren't aware. Like we're not taught that in school. I've never
No.
had my family doctor talk to me about that over the years. So it's definitely something that needs to be more widely known.
Yeah, because so many of us in our teens and 20s were so scared of getting pregnant
Yes.
accidentally, right?
Yeah.
And of course, I'm not saying that doesn't happen. It does
Hmm.
happen. But when you start to look at the statistics of it and how small, I guess, the percentage is that accidents will happen, I wish that was also taught to an extent where you realize what all those obstacles that are in your way, right? If
Hmm.
everything, like you said, was normal, there's still all these obstacles. And then you add in all the extra stuff that happens with endo or PCOS or thyroid or,
Hmm.
right? There's tons of things that can kind of come in that nobody thinks about, not all at once. So you're
Yeah.
right. That's a huge thing. So that's my like, that's a very long way of saying that's my number one thing. And my other one is, of course, I'm a little bit biased, but I think that you should definitely, if you're thinking about getting pregnant, it's a great time to kind of assess your diet, assess your lifestyle, take a look at everything and just kind of tweak it a little bit to make it healthier, to make it so that you have all of the nutrients that you need for you so that you're topped up enough to give to baby because once you are pregnant that's a hard thing to start at that point. To work on all that beforehand would be so much better. So I would say, whether it's with your naturopath or even your family doctor, some family doctors are great at that, a functional medicine doctor, a nutritionist, a dietitian, like all sorts of people can help.
Hmm.
But just get that information out there.
Perfect. Thank you
Yeah,
so much. How old
no
is your little
problem.
one now?
He's 1.5.
Aw.
Yeah,
Very, very nice.
yeah.
Well, thank you so much for joining me. I'm so excited to be doing the series and meeting a bunch of amazing women like you. And it's so awesome to hear you like go on such a roller coaster of a journey and then find success at the end. I think that's a really great story to tell and will give hope to a lot of people. So thank you.
Yeah. I hope nobody else has to go through such a crazy roller coaster. But yeah, it's definitely possible. I was 39 when I had him.
It
There's
gives
a
me
lot
hope for
of,
sure.
yeah, there's a lot of potential out there. And there's a lot of people out there who are willing to help as well. So